So would you like to add something to the?
Another one which I commonly which I face is getting delayed. The diagnosis get delayed. So it's like the common misconception which I get is আগে কেন বলেননি, মানে এই জিনিসটা কি হচ্ছে না, ঘরের বড়রা বলেছে কি কথা বলছে না তো ঠিক আছে, পরে নিয়ে গেলে তোর বাবা তো কথা বলেছিল 5 বছর বয়সে। So that difference, that
The
once
generalization of it.
maybe the pediatrician also was maybe in his first year this visit was not able to tick the particular thing, like if the child is not speaking, when the speech is not proper, because already সে মানে ওইখানে ভ্যাকসিন, আচ্ছা ঠিক আছে ভ্যাকসিন ডাক্তারের কাছে গেছে, ভ্যাকসিনের কাছে আমি ভ্যাকসিন করিয়ে নিয়ে এলাম, কিন্তু যে কথা বলছে না ঠিক করে, সো এইটা তো ওইখানটায় আর কি মেন মানে ইয়েটা থাকে কি হ্যাঁ ওইখানেই মানে ডিলেটা হয়ে যায়।
How important is teacher training, fostering, and inclusion of understanding these?
Okay. Maybe I'm not really the correct person to say, but I'll say it from the perspective of what I've heard from my patients. তো অনেক সময় যেটা দেখা যায় যে বাচ্চাদের মধ্যে হয়তো মানে because we said it's autism is a spectrum disorder. There are people who do not really have an intellectual disability but might have a learning disability. ठीक है तो so what happens is that এই বাচ্চাগুলো these children get picked up in school by the teachers, because most of the teachers are probably not really trained, though they are supposed to, in picking up learning disorders well. I'm thinking that Sarba we would probably better answer this question. But what happens is that most of the time these parents would come up and will be called in the school for the child not doing well, not being able to submit. The child might show resistance in not being able to sit in the class, or the child not paying attention in the class. Sometimes it's also that we get a lot of these cases, they are being bullied in the class. And these children also at certain times they say that we can they probably can figure out that they are a bit different, and they go into those shells and they start feeling worthless, and that's a very heavy feeling. But that is how the school does not take that extra step to understand why the child is not doing well in class. So a simple thing like this is from my personal experience, when I would say is the first thing is that ki apnar bachcha to mane onno bachchar moto porche na, onno bachchara 99.9% paচ্ছে, আপনার বাচ্চা তো 60% পাচ্ছে, মানে that's the first land. And if আপনার বাচ্চা 99.9% পাচ্ছে না, তাহলে this is not the place. You should do some assessment and tagging. ও তো বোধহয় মানে maybe the child has some other issues, but ও তো ADHD আছে. And this person does not even know what ADHD is, what is the criteria.
They jump the gun.
Yeah. Right?
So I think so. A while back we were talking about inclusion as a part of therapy. Now, who's going to include them? The parents are, once a diagnosis is made and you've gone through that denial phase, you've motivated them to get this child stimulated. Stimulated where? One is home, the other is school. Who's going to stimulate them at school? So unless and until you are training the teachers, and as Dipanjana said, it is mandatory now that if I am going to have an inclusive society, if I am going to be integrating them into the mainstream so that they don't feel left out, I must learn how to handle their special needs. They could have sensory issues. A child might just have a breakdown in a class full of children who are screaming, might just want his own space. So unless and until the teacher realizes that this child doesn't want to join the screaming and yelling that is going on, needs a quiet corner, quietly takes away the child into a quiet corner, or if the teacher doesn't realize that what she's trying to teach the rest of the class, this child needs a half an hour extra for this, okay? How are we going to integrate them into mainstream? So it is absolutely imperative that teachers' training, especially while we look to integrate them into the mainstream, is made compulsory. Because the teacher is the one who is going to be doing the work of the parent while the child is at school. And if the two are not in sync, a lot of good work that is being done by the parents, it gets destroyed in the school.
Okay. Especially because children spend a lot of their growing up years at school away from the parents.
And even when once the teacher says like just go and have a test for ADHD, and then they search parents they search this in the Google এ দেখলো autism স্যার LD টেস্ট আমি করি নেবো কিন্তু আমি কি অটিজমের টেস্টটা কেন করাতে যাবো? কারণ অটিজমের টেস্ট মানে যদি দেখতে হয় ইনক্লুশন না ইনক্লুশন ঠিক আছে কিন্তু স্যার অটিজমটা বাদ দিয়ে বাকি টেস্টগুলো করুন। So this is what the common and the coming up to the denial part, autism तो एक गाली जैसा हो गया মানে এটা মানে ये হয়ে গেছে কি এটা কেন বললো আমাকে LD বলুক লার্নিং ডিসেবিলিটি চলবে কিন্তু অটিজম যেন না বলে।
The misconception runs so deep that you rather not be diagnosed.
So I will just give you an example. So we do race for seven, right? So people don't understand what is how sensitive or how insensitive they can be. So say we just went to a few runners, joggers, asking them, a group of joggers asking them to come. And when I said this is rare disease or not, the first thing they said, oh, the autistic children. And I'm like, no, not really. So you have to understand that even I would say Bollywood, Hollywood, though there are wonderful movies that have come out, but they have very typecasted autism in one way. All right. So the other way around is the teachers. Some teachers, they are also not in that psychological mindset to actually, be in that zone to actually look at the child, look at the parents, be empathetic enough to say certain things. I feel when training is there, even the background of the teacher becomes very important while, you are...
As Sir was saying a while back, breaking it gently, knowing how to break it to the parent
This
as
should
well.
be done by the school counselor. And in many schools, the school counselor is just a name. Nobody has seen a school counselor. Because they are supposed to have a school counselor, the school counselor stays. And it's otherwise just a name.
As in, they are on the books, but they aren't really there.
And we must also, get this message across that labeling someone with a criterion, with a diagnostic and statistical manual, the DSM criteria, it requires an objective assessment. Just like, you cannot label a person a diabetic without doing a blood sugar, unless and until you've administered the multiple tests to a person who is neurodiverse and you've come to a definitive conclusion. There is nobody has the right, not even me as a doctor has the right to label someone something. So when you're making a referral, like Oshiman said, or Dipanjana said, that a school counselor, class teacher, whoever is making the referral, they have to be very careful about what words they're using, because we don't want to be setting off a panic reaction here. We need to tell them that, look, your child is showing signs that he or she might be special, maybe different from the rest of the class. So let us find the difference. Let us find what is special in our child, and then we can help your child. The moment you tell them something like a disability, we don't talk about disability now. It's all in the eyes of the person who is seeing it, right? We are trying to get them to be treated as special children, because they are indeed special, because when they go through the whole treatment and they reach their potential, we realize how bright and how beautiful they are, right?
So, but here also one thing, like, when you are when you are making a referral, there is a responsibility there, that, you have to be very, you have to explain to them what is happening. Like if Sir or Oshnanda makes a referral to genetics, people would be very, I don't want to go to genetics. Why should I? So even when we are making a referral like this, see, it's not easy for the parents. Like being a mother, if somebody says something, it's not an easy thing to even accept. So you have to understand that point. So somebody has to actually counsel over there, spend some time. It cannot be in a PTM, you are sitting in a class which is like 100 people and you are just narrating at, your child is very ADHD থাকতে পারে, আপনি তো একটু একটু অ্যাসেসমেন্ট করে আসো, that's not the way, and that is how it is done. So that is definitely not the way. So you have to isolate, you have to speak, you have to be empathetic, you have to also tell them the consequences. What happens if there is a diagnosis? What happens after that? And how the parents can deal. Like, you have to spend that time with that person when you make a referral. Because obviously, I have doctors who are patients whose children, when sir, everybody will agree, then they are probably the most difficult parents, যাদের বাচ্চাদের autism হলে, to convince them to go to and see a therapist or a doctor or anything of this.
Very true.
Because they have a lot of, they know what is going to happen, and that is why they are scared of it. Okay, so borrow if somebody
Somehow the knowledge scares them.
somebody is coming from a rural area to explain them, apni ekhane jaben, ei hobe, oi hobe, that person is a clean slate. So now whatever we say, people will do a chat GPT. So you have to counsel them first, because if you don't, then you are actually pushing them into not only darkness, but ওরা হয়তো ultimately সেই কনসাইটটায় গিয়ে উঠতে পারবে না।
How important would you feel as counseling? How important and how early do you think it should come in?
Can I just rephrase that term? You cannot just counsel. You've got to do something called a motivational counseling. If you look at the premier mental health, guidelines, you cannot just do counseling, because, when you're counseling, the so-called counselor is on a pedestal and trying to be very judgmental. It's a partnership, right? So you have to, the purpose of counseling is to motivate the recipient to be an equal partner. Here it is the parent. Once the child grows older, it has to be the child who will have to be an equal partner in any developmental activity, in any stimulation activity that we would want that child to go through. If the person is unwilling, there's no way we are going to get them onto the particular therapy or activity that we plan for them. So counseling is very important, not from a pedestal